Good evening and thank you for joining us for Creme to News at 6 tonight. I'm Mark Hanrahan.
It's good to have you here. I'm Whitney Ward. The Spokane Regional Health District has officially chosen our current interim health officer to take on the position now permanently. That decision comes nearly a year after the health district unexpectedly fired Dr. Bob Lutz, who held that position for 3 years.
Creme 2's Amanda Rowley sat in on that board meeting today. Amanda, how do we know or what do we know about how this decision was made?
Well, Mark and Whitney, the Spokane Regional Health District's Board of Health had 8 total candidates, which they narrowed down to 2 finalists. Members of the board were involved in the interview process, which started back in the spring through a recruitment firm. We also learned members of internal staff also participated.
All those in favor signify by saying aye.
Aye.
By a unanimous vote, Spokane Regional Health District's Board of Health selected Dr. Frank Velazquez as its new health officer.
We got some good applicants and he just rose to the top.
Spokane City Council member Betsy Wilkerson serves on the Spokane County Board of Health. She told me the recruiting firm recommended not making the list of candidates public to protect the applicants and where they are currently working.
This process was really important to me, that we do a search to help restore confidence in the health district.
Wilkerson explained Dr. Velazquez's work the last 10 months as interim health officer prove he is the right fit for the job.
With Dr. Velazquez demonstrated leadership in the community, the relationships he has made with the staff who spoke extremely highly of him.
Dr. Velazquez previously indicated he did not want the position permanently. This afternoon, he explained what changed his mind.
But the more that I spend the time with the people and what we do every day, the more I realize that this is really not only what I wanted to do, but the best way for me to make a contribution to the community that I really love.
Most of his previous work was in medical consulting and administration, but he is a doctor. He got his MD in Puerto Rico, then he earned a master's degree in healthcare management from Harvard University. Dr. Velazquez was also formerly the president and CEO of PAML, which is a Spokane-based lab company.
Now, District Administrator Amelia Clark was also involved in the interview process. The administrator does not need board approval to appoint a new health officer. The unanimous vote was a formality, but Wilkerson says it was also a chance for the board to have a voice in the selection of the new health officer. Reporting in the newsroom, Amanda Rowley, Creme 2 News.
Amanda, thank you very much. And we have done extensive reporting on this story and a lot certainly has happened. So here is a quick timeline of the events.
So we start in October of last year, where the health district sent out a press release saying that Dr. Lutz had abruptly been asked to resign that same day. District officials then held a press conference where they reportedly evaded questions or repeatedly evaded questions about whether Lutz had resigned or had he been fired.
Effective yesterday.
That Dr. Lutz is no longer the health officer at the health district. Because this is a personnel issue, I'm not able to go into that. At this point, under advice of counsel, I really can't go into details regarding that.
In the aftermath, supporters of Dr. Bob Lutz gathered outside the SRHD building in protest of the board's decision to fire Lutz.
So then a few days later, Dr. Lutz released a statement through his attorney. It said SRHD Administrator Amelia Clark had fired him on October 29th and even took his laptop and other materials. The administrator's actions, he said, would have been illegal at that point because only the board can fire the health officer through a public vote.
On November 5th, the board held a special meeting to decide Lutz's fate as the health officer. Clark presented a long list of personal and professional misconduct allegations against him, including insubordination and sexual harassment, allegations that Lutz denied. She then called for his termination.
It's clear to me that Dr. Lutz is unwilling to make the necessary changes to be a successful part of the Spokane Regional Health District team moving forward.
So Lutz and his attorney argued those allegations were trivial compared to the importance of having a competent professional in the role of health officer during a pandemic.
You will find that they in no way constitute a reasonable basis to fire me.
The board disagreed, voting 8-4 in favor of his termination. That same night, they unanimously approved a new interim health officer, Dr. Frank Velazquez. Dr. Velazquez said he did not want to keep that position permanently. And that brings us to today, when Dr. Velazquez has been approved as the new health officer permanently. SRHD's Board of Health began searching for a permanent replacement through a recruiting firm.
But actually, the story doesn't really end there, because 4 days after Dr. Lutz was fired, the Washington State Board of Health also then decided to investigate multiple complaints made by citizens against Administrator Amelia Clark.
The complaints allege that Clark violated state law by forcing out Lutz without board approval.
I think we had ample information that was provided that Ms. Clark was wrong. She did not follow the RCW, her role and responsibilities. That is her job as administrator. She should have known. And there's no denying that he was terminated on the 29th.
The board investigating Clark voted unanimously that there is enough to go ahead with a formal hearing. A date for that has not yet been set.
In the meantime, we want to go over the numbers for COVID cases here locally. Hundreds of people still hospitalized in Spokane County with coronavirus. According to the Regional Health District, 186 people are hospitalized right now. 2 new deaths were also reported today, and 263 new cases also reported.
Unfortunately, over the past week, we've seen yet another significant surge in our COVID volumes.
In new COVID cases, Kootenai Health in North Idaho is dealing with the opposite. In Idaho, vaccination rates are low, the positivity rate is high, and hospital staff there is exhausted.
So leaders at Kootenai Health are painting a grim picture of the COVID situation right now. They're admitting between 10 to 20 new COVID patients every single day. And during their weekly press conference today, you could tell that staff there is tired and frustrated.
Yesterday, we had 145 patients admitted to the hospital. That number has grown to 150 today.
As the nation is finally seeing a decrease in new COVID cases, hospital leaders in North Idaho say they're dealing with the opposite. At Kootenai Health, they have 35 more COVID patients today compared to a week ago. 43 of those COVID patients are in critical care and 17 are on ventilators. The frontline workers tasked with caring for them are, simply put, exhausted.
It continues to amaze me how our clinical staff, our support staff, our physicians, our leaders are able to accommodate this surge.
Staff like Dr. Robert Scoggins. Unlike previous surges, he said, this one, fueled by the Delta variant, is proving more deadly and is impacting younger people.
We've seen a lot of deaths, averaging about 1 a day in the COVID population. I just spent the last week in the ICU. And it's a very hard place to work right now.
Scoggins said the hospital is admitting between 10 and 20 new COVID patients every day. And with a positivity rate of around 27%, they don't anticipate the surge to subside anytime soon.
The volume is unbelievable. The number of patients that are on the verge of being intubated or in times dying is extraordinary.
Adding to the frustration, the vaccines are extremely effective and readily available, but Idaho's vaccination rate ranks among the worst in the nation. Scoggins says too many are taking the virus too lightly.
I think the one thing that people don't realize is that even if you make it out of the hospital that and go home, what we're seeing is a lot of people are going to have chronic lung disease. Many of them will need lung transplants. Their lives have changed.
Leaders at Kootenai Health pointed out today the team of doctors and nurses sent to them from the Department of Defense to help them have been key in helping them handle this latest surge of patients. That team, by the way, is slated to be at the hospital for just about 1 more month. We know a lot of information is out there and we just threw a lot of it at you. So if you would like to know more about Spokane's new health officer or about the coronavirus situation here, either in the Spokane area or in North Idaho, just text the word COVID to 509-448-2000. We'll send that link right to your phone. Let's switch gears and talk weather, shall we? Today was kind of a perfect fall day, a little bit of rain, then a little bit of sunshine. And hey, look at this pretty sunset once again. Right? Meteorologist Tom Sherry is joining us now from the Outdoor Weather Center. And Tom, I know you said that it's getting a lot cooler. Once that sun goes down, you really feel it, don't you?
Boy, it is chilly out here. It's gorgeous, but we would call this a very crisp evening. This would be a good evening to get some layers on and do a nice brisk walk. But gosh, it is gorgeous out here, no doubt about that, and a beautiful sunset. 54 degrees right now. We've got wind out of the south blowing at about 8 miles per hour, so not so bad in the wind department. We take a look at the satellite radar picture, not seeing really much in the way of cloud cover, certainly no precipitation. We saw that last night and early this morning. We'll look for a cold one tonight. Wide areas of frost likely for tomorrow morning and especially Friday morning. We're down to 35 overnight tonight, but Friday morning I think we'll get down to 32. Look for sunshine tomorrow with a daytime high of 60. Looking ahead to the weekend, it's another cold morning on Saturday, and then we'll look for rain to move into the area on Sunday. I'll check your 10-day forecast coming up in a couple of minutes.
Dr. Den, Tom, thank you very much. Meantime, still to come tonight, 4 people have been hurt, 1 in critical condition after a school shooting in Texas. What we know about the gunman and what prompted the shooting.